Welcome to our session on the science of scaling. We have two speakers for this session. The first is Mushfiq Mobarak. He is the founder and faculty director of the Yale Research Initiative on Innovation and Scale, aka YRISE. He's also a professor of economics at Yale University and with concurrent appointments in the School of Management and in the Department of Economics. Our second speaker is Heidi McAnnally-Linz. She is the Deputy Director of the Macmillan Center for International and Area Studies at Yale University, where YRISE is housed, and previously spent a decade leading evidence to impact work at Innovations for Poverty Action. Please give a warm welcome to our two speakers, Mushfiq Mobarak and Heidi McAnnally-Linz. Thank you.
Thanks very much. Hi, everyone. Thank you for being here. It's my first EA Global. And I'm going to talk to you about scaling. So the part of the EA movement that I'm more knowledgeable about or affiliated with is global health and development. And so scaling has been a very difficult word. It's been a big challenge. For anybody who works in global health and development, you'll immediately recognize why this is something that we worry about and think about a lot. So just a few examples. There's a study on early childhood development that many labor economists, development economists have been really excited about. A study done in the 1980s in Jamaica. It was done on 70 children, and we were so excited about it. On that sample of 70 children, we've probably had about 70 to 75 papers written. So the Inter-American Development Bank tried to scale this up, replicate the program in other countries. It started in Jamaica, they tried it in Peru, et cetera. That's where the title comes from, 700 to 70,000. And we get disappointing results, right? So this leads to lots of commentary about how apparently nothing scales, right? And then this is also true of some of the work I've been involved in. So I'll tell you that story today, briefly, of seasonal poverty, how to address it with seasonal migration, and with support from the EA community, we did scale it up, but that program is folded, so I'll tell you that story as to what's going on there. And when you ask questions about what does scale, people think of as really simple programs where we take all kinds of decision-making away from say, implementers, or I shouldn't say that, not decision-making away, but all sorts of risks away from the implementers. Now, when we make claims that, okay, there are some programs that scale, like say giving out deworming pills, what I'm going to try and talk to you about today is that there's at least a couple of things that makes me uncomfortable about even those statements, right? And hopefully in the next 15 minutes, it'll be clear what those are. So for example, when we say something scales by saying, oh, we've actually given it out, that doesn't necessarily mean that, let's say, just making something up, like, you get 5 points for deworming a kid, and then we go and deworming 1 million kids. Do we get 5 million points for that? Probably not. But we haven't thought carefully about how do we do that accounting, and that's what I'll try to talk to you about today. Okay? So there's going to be just a single message that I hope to leave with everybody today. Being evidence-based requires applying rigorous standards. Of course, we are, I think, all familiar with that concept. But we should be applying those rigorous standards not just for this piloting phase, but also for the scaling phase. Right? That's the main message I'm going to try to leave you with. And we want to chart a constructive path forward as to how we should be thinking about scaling, how should we be thinking about evidence on scaling, and applying the same rigorous standards. Because what I'm worried about is right now, we're insisting in our community for policymakers, we're insisting on very high rigorous standards of evidence for the initial trial, right? Something that is before we can consider it promising that it's affecting people's lives in a positive way, we want to see a randomized control trial. And then we move from there to, okay, now let's scale it up now that we find it promising and it seems good. But then we kind of forget about the fact that we also, we can't just multiply things by 1 million, right? And therefore, we should be also applying rigorous standards to that second phase, and we're just not doing that enough, right? And I want to chart a constructive path forward and how we might be able to do that. Okay. So I'll tell you the no lean season story because it taught me a lot about what those new challenges are, the complexities of scaling are, and how we should be going about collecting evidence on that. Okay? So we started with not a solution, we started with a problem. So I grew up in Bangladesh, and one of the problems when I was growing up in the 1980s that was in the newspapers every year, especially during a certain season, is this problem of seasonal hunger, seasonal deprivation. And it has to do with the agricultural crop cycles, right? So I'll use the calendar in Bangladesh, which is what you have up here. So July, August is when people plant rice. That's the main almond rice planting season. Around December, January is when you harvest. So during July and August, as well as December and January, there's a lot of demand for people's labor. So most people in South Asia who are engaged in agriculture are actually landless. They're supplying their labor on other people's farms, okay? So therefore, during those months, like July or January, right, there's demand for labor, wages are, you're earning wages, landless laborers are, so food security is there. There's not as much of a problem of food insecurity. Okay? And what I have plotted here are people who are reporting that they miss meals, so a measure of food insecurity. Okay? Now, in between the pre-harvest period, what's happening is that you're basically waiting for the crop to grow, right? And so there's not much to do. So the landless laborers, their labor demand falls, the wages fall, and unfortunately it also happens to be coincident with the period when the price of rice goes up. Probably has to do with the fact that it's been the longest time since the last rice harvest. Okay? So then you have a combination of low wages, high prices, and so something's got to give, and that's calories. Right? People consume less. And so often they're going by with 2 meals a day. So this is representative of the data here. I've been tracking this since about 2007. It's representative of about, Rangpur region, which houses like over 10 million people, and maybe the landless laborers, the near landless people, that would be about the poorest 65% of the population. Okay? So a lot of people are still, even today, are reporting missing meals. Okay? So now the question is, what do you do about that? The government had programs like food for work programs, or the NGOs had targeted microcredit programs, right? One thing that we hadn't tried out, that I wanted to try out myself, was this idea that maybe it's going to be cheaper for us to get people to where the jobs are rather than force job creation in this location, where for structural reasons we understand that there is unemployment. Right? It's not easy to create jobs in an agrarian economy where the crop is still growing. Right? There's not much to do. Okay? There's some weeding tasks, et cetera, but there's really not much, and so labor demand does fall during that period. So with the observation that, look, a lot of these people are living like 4 to 5 hours away from nearby cities, where the labor market is not so seasonal. You can go work in construction, you can go pull a rickshaw, et cetera, and go to Dhaka, pull a rickshaw. That perhaps, that's another strategy in the menu of strategies that we should try out, right? So that's where the research started. So we started doing this in 2007. And the original program was, and I actually hadn't heard the phrase effective altruism or anything like that back then. So the original trial in northern Bangladesh basically had this simple design. It was a randomized control trial. So for some people randomly chosen, or some villages, we went and offered like the equivalent of $11.50 at the time, which would pay for the round-trip bus fare plus a couple of days of food, right? So we're going and telling people, right, if conditional on somebody from this household trying this out, like migrate to the city, try to find work, right? I'll cover the round-trip bus fare, right? So we just want somebody to try it out. And I'm not adding any more conditions, like who from the household needs to go, where you should go, how long you should stay, none of that, right? Just the only condition is somebody should take the trip and try it out, and that's what we monitored. Okay, and the idea was, okay, maybe hopefully they'll go to the city, find work in construction, rickshaw pulling, and then either bring money back home or send money back home. Okay? And so here's what happened with the trial. So the first result on the left-hand side is what you have is about 35% of households in this region were already migrating to deal with seasonal poverty. So it's one of the strategies they were already using. That's where the idea came from. Now, if you offer that $11.50, either in the form of a loan or a grant, the migration rate jumps to about 60%. Okay, so you can induce about 25% extra households to try this out. Okay, so people go. Okay, and the second thing is that now that people go, you have random variation in migration. You can use that random variation to study what the effects are. And the bottom line result is that if you're induced to move by this program, then your family ends up consuming, back home, they consume about 600 calories per person per day more. Right? It was a surprisingly large effect in that you're moving from 2 meals to 3 meals a day. And to be clear, nobody's getting rich off of this. Like, for example, nobody saves anything, right? I mean, people are extremely poor here. Marginal propensity to consume is very, very high. They're just eating every extra dollar, right, as they should. And then the third thing that was also a bit surprising is that a year later and 3 years later, that's what you see on the right-hand side, 2008, 2011, I just go back to those same areas and had a sample where we did not intervene in any other way, again. And what we learned is that a lot of the people we induced to migrate in 2008, they choose to migrate during that same season again in 2009 and 2011. Okay? And so what's going on? And by the way, it's about half the people who were induced to move, they choose to remigrate. And that's on their own volition, using their own money. Okay? And so what's going on when we go and ask people in 2011, what were you doing? The majority report, we actually go back and work for the same employer that we had met back in 2008, right? So it's not like people saved up and now they have more money to travel or anything like that. It's just that you make a connection to an employer and he says, okay, you've proven yourself to be a reliable worker, come back next year, you can have the same job. Okay? Something like that. Okay, so that's the story of what happened with the trial. And then as an economist, I had to think carefully about why is it that people were behaving this way, et cetera. So that's where the research went. But that's where I first had a conversation with somebody from GiveWell who had read the paper, and they were interested in figuring out what the potential for this program is. Right? And here's how the conversation went. Right? So my reaction was, look, we ran this trial, and I stand by the result. It was well done. Like, our team is good in collecting data, et cetera. But we just focused on what I report on is the direct economic benefits accruing to the beneficiaries who received the transfers. Right? Now, if you're thinking about scaling this up, that's what the question was about. That's not the only thing we should care about or worry about. Okay? So what else should we care about? So we, actually, from that first call, we started making lists of what are all the uncertainties that are there. Okay? So one dimension that we should be thinking about is that economics is not the only thing that matters. So that's why you have to move down on the slide. And the other thing is that those beneficiaries interact with other people in a variety of ways, in the labor market, through risk sharing, their friends and neighbors, their social networks, right? And they're also going to start interacting with people in the city who they don't currently know, and all those other people's lives will also be affected in ways that are currently unknown. Right? And therefore, if you really do want to be evidence-based about the scaling decisions, we should take this seriously, right? And we should try and understand systematically not only what the direct economic effects are, but what are a lot of the unintended consequences, right? And what economists call general equilibrium effects. What are the spillover effects on other people who live in the village that the people are migrating away from, and other people who live in the city that the people are migrating to. Yeah? Okay, so let's talk through. I do want to get into one additional level of detail here, right? Because that'll help make one of the important points I want to make. Is that this is not just a question of just collecting some additional data or running the trial again, okay? Running the same trial again to collect the additional data. Some of those things are. So let's think about what are the non-economic effects that we care about, okay? So if you get people to migrate, so we know it's the adult male who's typically migrating. So now, and the wife and children remain behind, right? So now if the husband's gone or the father's gone for a couple of months, that's going to perhaps change the relationship between the husband and the wife, right? We should be seeing if that changes household structure. Do divorces go up? It might actually put women at the risk of greater domestic violence, because we know one of the risk factors is the share of household income that's earned by the husband acts as a risk factor for violence for the wife, right? We should be tracking that. That would be an unintended consequence. But it could go the other way. In the husband's absence, maybe women get more empowered, right? But either way, a more comprehensive evaluation would require us to think through all of those things and also figure out ways to aggregate across those different domains, right? Okay, and now let me talk about something else that's harder to do, right? In that same bottom left corner, okay? Now, when you migrate, your income consumption goes up, great, but that comes with family separation. Okay? Now, that family separation is relevant to people's welfare, right? But it's not the case that I can just, like on if I wanted to just track divorce rates, I could go back, run the same trial, and collect that additional variable. What's the divorce rate in the treatment villages versus control villages? But for something like family separation, what I would have to do is, I wouldn't do this, but the idea would be, oh, you have to go and ask people, how much do you miss your kids? And then now tell me the dollar value of how much you miss your kids. Right? I mean, that would be a ridiculous thing to do. So, I mean, that's not the strategy. We have to develop new and different methods, which we have. So we have other papers now to try and understand what the implied disutility, or in dollar terms, is from migrating. Okay? So it requires us to be a bit more ambitious, expand our methodological toolkit, right? And combine not just data collection, but also some modeling. Okay? And then now if you think about what I was calling equilibrium effects, right? So when people leave villages, now what happens is, so let's say there's a bunch of skilled and unskilled people in the village, right? And if you make migration offers, maybe the skilled people leave first because they're going to do better in the city. Okay? So in that case, if skilled and unskilled workers are complements in production, then it might be that the people remaining behind are actually worse off. Okay? So that's a labor market interaction. On the other hand, it could also be that if a lot of your competitors leave, maybe wages won't fall so much during the lean season in the village, just because the labor supply curve has now shifted to the left. Okay? So it could go either way. And then another dimension, aside from labor markets, is that, look, we're in the village, we're all part of a network, we help each other out because we don't have formal insurance. So our insurance is, if I'm going through a hard time, if I have a health shock, Dan gives me some money with the understanding that in a future year, if he is going through a hard time, I'll give him money or I'll give his friend money, whoever needs it, right? That's how risk sharing works, right? And that's a really important institution in South Asia. Okay? Now, if I now induce some people to move out and now they have a better option, like just going at it by themselves, I might start straining those networks, and then the other people who don't have the ability to go or don't get the opportunity to go, they might be worse off. But on the other hand, it could also be the case that if Dan and I are friends, I now have a new opportunity. He's better off because I'm going to be sharing with him. Right? Either way, we really need to think through how this works. And again, this is going to be complicated. And the reason it's complicated is that your risk-sharing environment, like the amount of insurance you already have through your friends, that itself will determine whether or not you're able to take on an offer and leave. Right? So even a randomized control trial by itself is not going to be sufficient for us to understand that. Okay? We need to think about other methods for that. So obviously, this is not an economics lecture, so I'm not going to the details of what are the equations we'd have to estimate here, right? I just want to give you a flavor for the idea that, look, we can't just pretend like we can do randomized control trials, we're done, we have all the knowledge that we need, right? Especially when interventions are complicated, they have complex effects on people's lives. We have to think through theory, we have to think through various domains that sometimes fall outside of economics, right? And it requires new methods, new techniques. It requires us to be a little bit more ambitious and take some more risks. Okay? So ultimately, okay, what happened with this program? So I told you, I promised that I'd share the story with you. So we checked all of this, right? It actually checks out pretty well. So this is what we did for several years. We had to run, in order to study the spillover effects, we had to run trials at larger scale. Then we started running market level trials where we randomly varied the proportion of people who were receiving offers to study some of these questions, right? So all checks out, great. And so we continued going. So we basically scaled up in stages. We said, okay, let's go from 2,000 to 30,000. And at that stage, right, the rural spillovers, that second column, those are the questions we can answer at that scale. So let's do it. And then only then, if it checks out, then we'll move to 150,000, right? And then we'll ask the questions that are relevant at that stage, which is what happens in the city. It wouldn't be sensible for us to start studying what happens in the city when we're only making offers to 30,000 people, because 30,000 might be a lot, but in a city in Bangladesh, which has 160 million people, it's like a drop in the bucket. Right? So you have to just make your evidence also the right fit for the context. Okay? All right, so all that checks out, and what happens at the end? So we go to 150,000, So we turn it over to an implementer, right, who happens to be a microcredit organization, and just said, look, you give microcredit loans. Can you just design and offer this new product where instead of insisting on repayment every 2 weeks, like think about the fact that people are taking migration loans and they're going to return in like 3-4 months, right? And that should be the repayment date, right? Okay, and then so they're like, great, we'll do this. And thanks to GiveWell, other effective altruists who supported that program, the scale up to the 150,000 per year. And so here's what the implementer ended up doing, right? Which ex post makes a lot of sense from their perspective, and they thought they were successful, but by our data, by our metric, I wouldn't call it successful. Okay, here's what happened. Okay, so basically, you have this goal of 150,000, so that goal from the top of the organization gets filtered down to like what they call the migration officer in every village. So everybody gets a target. And let's say you get a target of like 40, 50 people you need to give the loans to, right? So now remember what I told you for the earlier study, that there were 60 people were migrating off of our intervention. Some of them would have gone anyway. I know this because in control groups, some people are going. Others were induced to move, right? But we don't know who is who, right? We see the 60 people. I can't tell if you would have gone anyway, or is it somebody who you newly induced, right? Now, the program effect comes entirely from what we call compliers, people who would not go absent the intervention, okay? So now imagine a migration officer in rural Bangladesh, and they're given the target, right? Who do they go after first? They'd go after the people who are most eager to go, right? So by their metric, the program looked fantastic, right? We hit our targets, right? But the problem is, it doesn't actually change on the margin people's migration decisions as much, right? So instead of seeing that 25% effect, we started seeing something like a 6 to 9% effect. Okay? And if you don't change migration decisions, because these are the people who would have gone anyway, then of course your program is not going to be effective. Even if a microcredit organization, given their culture of like how do we measure, what are our metrics there, it's like how many loans do we give out, right? But of course, as effective altruists, we might care about not just how many loans are given out, but what kind of an effect it has on the person's consumption in their life. Okay? All right, so I'm done with the story. So let me just generalize the lessons from this, and I'll end, and I'll hand it over to Heidi. Okay? So so basically, from this experience, my thought process was, right? Look, we do need to think through all of these complexities of scale, right? But it's not true for just a migration program. It should be true for all programs that we claim to be evidence-based, right? And then we thought about, okay, what are the different domains in which these complexities arise, right? So let me just walk through some of these, like political economy. So sometimes when you're, running a pilot scale trial, often government or the politicians don't notice or care all that much, right? But of course, if there's a chance it becomes policy, then of course they're going to notice, they're going to react to it, right? So let's say you provide skills training, right? We get excited about, we provide skills training, people get more jobs, right? Now, the government might react to it saying that, oh, you guys are providing skills training here, so let me just redirect my resources elsewhere. So at scale, the program will not have the exact same effect as it does in the pilot, right? But it could be exactly the opposite, which is the government says, okay, you're creating skilled workers here, let me use my industrial policy to build factories here to take advantage of the skilled workers. In which case, with that complementarity, at scale, the program effects might actually be even better than what you saw in the pilot, right? But whichever way it goes, to have comprehensive evaluation, we need to think through that interaction, like what the politician reaction might be. And that also requires a science, right? Because sometimes, the stories I just told were really simple, but a more complicated story would be something we've seen in programs in Bangladesh, other sanitation programs I've trialed. The politicians sometimes react by saying, oh, look, people like this program, or they're getting something at a subsidized rate. So then they react by attaching themselves to the program, right? They want to come give speeches at the distribution ceremony or something, right? And so what happens then is now you've muddled the information environment for voters. So voters are going to have a harder time distinguishing between a politician who's good, puts in effort, brings programs to their locality, versus a politician who's opportunistic, right? And that may be the fundamental cause of the underdevelopment, not the little sanitation program I'm running, right? And so we need to think through that, and that requires us to branch out to political science, political economy people who think through that and design data collection in that domain. So let me actually just not go into that level of detail in the interest of time. So we've already talked about spillovers. In the case of a skill building program, you provide skills to 200 people, they get jobs, they do better. If you provide the same skills to 10,000, maybe they'll just compete with each other if the number of jobs haven't gone up, right? So then skilled wages fall, program effects are not as great, right? You want to do macro modeling for tracking welfare. And then we also have this problem of external validity. How do we aggregate evidence? If we see a skills program in Peru and we see one in Nepal, right? What do we learn across the two? Can it teach us anything about what types of places in Kenya, what types of districts in Kenya we should be prioritizing where it's most likely to work, right? And there are methods being developed for that. Okay? So the idea is, my general message is that we really need to think through complexities in all these domains, and we need to emphasize the same standards of evidence for this second phase, for the scale-up phase, as we do for the pilot. Okay? So that's where, so right now, the science of piloting interventions, the evaluating evidence at pilot scale, that's already really well developed. There are many organizations who are at this conference who do this really well. And where we are trying to add to that community is by creating, trying to develop the science for understanding systematically the complexities of scaling. Okay? That's the goal. Okay? All right, so what are the main lessons here? First, we all have a temptation, I've had it too, to sometimes declare victory on the basis of one trial, right? And declare victory a little bit too early. And then you say, look, we scaled it up by 1 million, therefore you should just multiply that trial's result by 1 million, you'll see our effect size, right? And that's a little bit too quick and dirty, okay? So I would instead say, please continue asking yourselves questions, right? And apply the same rigorous standards of evidence to the scaling process that actually got you excited about the program to begin with, okay? And that doesn't mean, I don't want to be a Debbie Downer, and I don't want to be a person that says, oh, look, we should hold back, sit on our hands until we have the full range of evidence, right? Because that's also a decision that has consequences on people's lives. Not doing something is a decision you're making, right? So instead, what I'd like everybody to do, what I'd like to do for my own work, is let's scale up in stages and continue asking questions that's sort of context relevant at that stage in the scaling process. So let's do things, but let's continue insisting on good evidence and questioning ourselves. And what's the nice thing about that is that you might actually, when you're tinkering with the program at different stages, you might actually learn something that's actually valuable for the implementation as well. Okay? So for us, like researchers, we need to expand the methodological toolkit. We need to become more comfortable, not just with RCTs, but a range of methods and how to combine them well. And the idea is that we should be creating an evidence base where we're tackling or attacking that same problem of, say, seasonal migration from multiple angles. Okay? Thinking about the politics, thinking about the sociological changes, right? And we make decisions on the basis of the accumulation of that evidence base rather than one-off studies. For funders, let's create incentives for collaboration, and that's between scaling organizations and researchers, right? So for scaling organizations, the important thing is that even though an organization may be designed around a particular cause, right, we really need to think about the incentives we have on how to be open to evidence, even if our cause ultimately proves to be not the right one. Right? And that's good for organizational growth as well. Thank you.
And with that, I just really want to drive home the point that Mushfiq made about how we shouldn't just continue to ask questions, right? We should act, right? This is a community that continues to ask questions a lot, and it's very important, and we need to improve the science of scaling in all the ways that Mushfiq pointed out. But I'm now going to tell you a story about how we tried to apply all of this in a rapid crisis situation. The story, and some of you may have heard about it, It's also research that Mushfiq and team ran, a team from Yale, Stanford Medical School, and Innovations for Poverty Action, where I was working at the time. And Mushfiq can't say it's perhaps most of the important research in the pandemic besides the vaccine trials, but I can, and the Atlantic can. And it really was an incredibly fast mobilization. And again, thanks in great part to this community, and particularly to GiveWell, was able to very quickly mobilize the funding to make this possible. So I want to set the stage for you. It's April 2021. I don't know if you remember, but that was when everything in India was just going absolutely haywire in the pandemic. It was the Delta wave. It was just lack of oxygen everywhere. Right about that time, we started getting little inklings of the results from the 350,000 person randomized control trial on mask wearing that had been done in Bangladesh. And these results were looking really positive. And that was the point at which I started to be able to get involved with the team. And Mushfiq and I very quickly said, it's an emergency situation. We've got to use the best evidence that we have and scale very quickly. So what can we do? All right, so first, it turns out that we were able to find a model. We were able to operate at such a very large scale in this RCT that we were able to try dozens of different ways to improve mask wearing at a community level. And since it's a social norm, it's a very complex thing to try to get people to wear masks more often, right? And so here's the model that we found that not only tripled community mask wearing, and it tripled it from 13% of people in a community in Bangladesh wearing masks to 42% of a community wearing masks, which is important for the results later, so remember that. And ultimately, it did reduce symptomatic COVID-19. So the model. We call it NORM because of social norm and because of the acronym. So it was no cost, free masks distributed door to door, right? So we had people going door to door, giving out masks. And this was important because you needed to know that everyone in the community had a mask. They couldn't just say, I can't wear a mask because I don't have one, right? And then we offered information on why mask wearing was good for your community, why it was able to kind of help protect you and your family and your community, and it was good for the world, right? And we used some of the most important leaders in Bangladesh, famous cricket player and the prime minister, to kind of convey some of those messages, right? So we had modeling by these kind of trusted leaders, whether that was on the video or also in the community, where we encouraged imams and other leaders to model this behavior. And then finally, the most important part, and also the most difficult part to get right at scale, as you'll find out, was the reinforcement. And reinforcement is like this slight bit of social shame, right? Where if I see you entering, right? If today you were entering and I stood at the entrance and said, please put on your mask, right? You'd look at me like, all right, fine. Like, I thought we were done with this, but I'll put on my mask, right? And it turns out that just that slight social shame that this reinforcement triggered was really important and transformational in moving from just a slight increase in mask wearing to a very large increase in mask wearing. And yeah, I should say this study was a massive collaboration between so many organizations, but the primary ones being IPA, Stanford Medicine, and Yale, as well as GiveWell for funding. So there's tons of results, and there's lots of great videos, especially of Mushfiq presenting these results, so you can go watch those later. I'm not gonna bore you with those, and you can check out kind of the full results in either the science paper or in the tiny URL, but just for the purposes of the story, I'm gonna tell you the model with surgical masks, the model overall decreased COVID transmission for symptomatic individuals. We only tested those who were symptomatic, so that's very important. And so these results are for symptomatic COVID. And it turns out that 13% to 42% difference in wearing masks at the community level, it's important to note at the community level, right? With surgical masks prevented 1 in 3 symptomatic COVID cases in people over 60, right? And those are the most vulnerable people. And so those are the cases that you really want to prevent. Now, importantly, this doesn't mean that only people over 60 should wear masks, right? This was a community level intervention where everyone was wearing masks. And we think there was something really important about that, especially for the most vulnerable. Again, this was the results with surgical masks. All right, so then we were armed with this, right, in this crisis situation. And we were thinking about the rest of South Asia, right? Everybody in Bangladesh was reaching out to Mushfiq. Everybody that we knew in various communities were reaching out to us saying, what can we do in India? We know you've got this study. Is there anything we can do, right? So we had to scale, and we had to scale quickly. And we simply just reached out to everyone we knew. We held webinars day and night. I think if you looked back at the WhatsApp messages and the calendars, it was just overwhelming. And anybody who would listen. And very quickly, we realized that it was getting traction. And among the first organizations that said they wanted to scale it was an organization called SEWA, a women's organization in India that was telling us that like their staff were literally dealing with people who were needing oxygen constantly. They needed to do something, and this felt like something that they could do. And so we very quickly built toolkits and helped them. We gave them all the scripts that they needed. We gave them literally word for word and translated. We mobilized a women in policy, economics and policy network to help us translate everything from Bangla to the local language. It was just this massive mobilization of people. And the leader of SEWA said, right after this presentation that Mushfiq gave, we're going to start implementing tomorrow. And we looked at each other, okay, sure, yeah, right. But within 2 weeks, we had somehow gotten them millions of masks, all the scripts, and they were scaling it up, right? And so after that, Mushfiq says, team. By that time, we had a very large team of people that were trying to push the scale up in multiple places, and we met on an almost daily basis at that point. We should try to scale this to 100 million people. And I looked at him, and I just started laughing. You're just crazy. Like, we can't possibly do that. And then BRAC entered. And BRAC, if you don't know, BRAC in Bangladesh is the world's largest NGO. And they had a reach of 80 million people right as the Omicron wave was starting. And we were able to mobilize and get masks from Haynes, which made a massive donation. And they were able to use their massive implementation capabilities and their logistics arms to actually move the masks to Bangladesh and get those masks to people, right? So I guess what I would say is that BRAC scale-up wasn't perfect, right? If you think back of all the questions that Mushfiq wanted to ask, we couldn't ask any of those in a crisis situation. All we could do was get the masks out, give them the protocols, do the very best we could. They didn't have enough staff. Their staff were getting sick. They didn't have enough funding to do all the reinforcement work, right? None of it was perfect, and we wanted to be able to measure much, much more than we did. But they and we have a hunch that this had something to do with the Omicron wave being much less severe in Bangladesh than it was in the rest of the region. We wish we could measure that better, but we think that's the case. And I think the other thing that we learned from this process was that we need kind of this ongoing engagement with at-scale partners. If we actually want things to change at scale, if we want systems to change at scale, you need to convince the top of the largest organization in the world to work with you quickly in a crisis and to continue to iterate together. Or you need to convince the largest governments, you need to convince existing at-scale organizations to take up the evidence that you have and then to work together to make that evidence stronger and to continue to learn and iterate. And so that's what we're going to do next. We don't have a name for it yet. We're just building the team and figuring it out, but hopefully next EA Global I'll have some exciting news to share with you on it. But we're bringing together world-class implementation that BRAC has with this kind of world-class science of scaling that we're developing in the YRISE network and making sure that evidence use happens at scale, but in close partnership with the implementers. And so with that, I'm just going to conclude with 5 quick takeaways before we get to some Q&A. So I argue that not only should we be rigorous, like Mushfiq is saying, about the science of scaling, the research at scale, we should also be rigorous about how we approach scaling and how we approach evidence use, right? I think too often we assume that publishing the paper is going to do it. And publishing the paper was critical. That the WHO, that was really skeptical on masks at the beginning, did change their policy, right, based on the RCT paper, right? Hugely important. But I think without being really intentional and rigorous about how we were pushing out the evidence and making sure that it was used, perhaps this great success story with BRAC in Bangladesh and others wouldn't have happened. So the first step, the most important one, co-creating the evidence from the beginning, right? Whether that's working with end users or people who would actually use the evidence, and working with various researchers who have the right skills and background. The second is making evidence accessible and strategically targeted, right? That means working to share those results with the right people at the right time, like we did in all of those webinars in the NORM model, right? And it's building buy-in, right? So it's going to working with SEWA and working with BRAC, and not just working with their teams, right? Not just making sure that their teams understand the evidence and why they want to use it and how they can apply it, but also working with their stakeholders, with their donors. We spent time talking to various people at USAID and the various banks and making sure that they were also bought in because they funded some of the implementation, or they were big funders of these scalers. Critical component. Advocating for funding, not just for the research. Everyone's, of course we want funding for the research, but we had to go and get 100 million masks from Hanes, for example. A story, we can tell you about that later. But we also had to advocate for funding for some staff time. We had to advocate for funding in BRAC already had some funding allocated to specific COVID response work, and we had to get that funding to agree to apply this model, right? So some of that work needs to be done, and some of those evidence translators really need to help with that. And then finally, the continued ongoing iteration and learning at scale that we hope to do with BRAC and the accelerator. And with that, I'll just conclude by re-emphasizing this main message that we have today. Being evidence-based requires applying rigorous standards, not just in the pilot phase and then scaling something up, but throughout the scaling phase and continuing to learn while we act. Thank you.
Alrighty. Thank you, guys. Outstanding. Super interested in asking a bunch of questions, and you can submit your questions through the Swap Card app. I'll try to get to as many as we possibly can. If we don't get to yours, you guys will have office hours, right, immediately following this session, and that's just going to be right in the lobby area outside of the main theater. So maybe just to start off, could you tell us a little bit more about what it was that you learned about the No Lean Season program that ultimately led you to kind of lose confidence and ultimately discontinue it? I got a little bit of a sense for that, but.
Right. So yeah, it's actually a complicated answer, but I'm going to try to be brief. So the one thing that's really important to convey is that the problem hasn't gone away. Seasonal hunger is a problem, right? Now, it's possible that seasonal migration is not the right solution. We know it's not the right solution for every geography. So for example, we're doing that work in Nepal now, and we've learned that, we don't actually need to support seasonal migration there because people are already migrating. However, they have trouble sending money back from India where they migrate to, so we need to solve the remittance problem there, right? So I think one short answer is that the problem is there, it's an important problem, and we've also learned a lot about the scale and scope of the problem globally, and it's big, right? So if anything, I've doubled down on various places in Eastern Indonesia, in Nepal, Zambia, in West Africa, where we are understanding the dimensions of the problem and what would be the right context-relevant intervention there. Right? Now, okay, so now maybe the question was about No Lean Season in Bangladesh, right? I think the issue there is that implementation, is an entire, so in those 5 circles that I had up there, the one I didn't talk much about was that implementation capacity. That matters, right? Mm-hmm. So even if you've checked all those boxes, you have the right evidence, there's proper direct effects, indirect effects, et cetera. And even then, when you turn it over to another implementer who has their own objectives that are different from, say, researchers or an effective altruist objectives, right? We need to think carefully about how do we align those objectives, right? So what led us to stop the program was that it wasn't being implemented properly. That's the simple answer.
Fascinating. So when I look at going back to the bar graphs that you had where 10% of people continued to migrate in subsequent years, right? And that was not funded, if I understood correctly. That seemed like a pretty big, delta. And I would have guessed that even if you had sort of assumed, okay, well, maybe the implementers are mostly giving the money to people who would have done it anyway. Maybe there's some multiple where it's like instead of an $11, per person impacted, maybe that now becomes 33 or whatever because you're only hitting 1 in 3. But if you told me that for $33 you could make that 10% difference,
might, yeah.
you know, kind of persistent, I would have thought that that still sounded pretty good. So what am I missing in that analysis?
Yeah, so, you know, for us to, you know, continue to be evidence-based, we'd have to see that, that there is a delta on the migration, as you pointed out, but it's large enough such that we can detect changes in the downstream outcomes, which is things like consumption, income, et cetera, right? Now, in the first stage, if you don't have a big delta, it becomes really difficult for us to statistically establish that those downstream outcomes are getting repeated, right? So the same way with the masks, right? The reason why we added the reinforcement, et cetera, right? Like if you don't get too many more people wearing masks, it becomes impossible to answer the epidemiological question whether mask wearing actually matters, right? The first stage is really important. So that's the issue. Like it's important statistically, but it's also important because, look, you know, the program does look much less cost effective if we cannot guarantee that a lot of people's decisions have been changed as a result of the program.
So when you guys think about these kind of downstream or spillover effects, how far do you chase that? Because you could sort of think, you know, you're getting already into pretty subtle situations when you get into like people's marital dynamics and what's going on in the home, and obviously that's very hard to observe. And you could even think, well, you know, geez, that extra bus ticket can contribute to climate change, or you know, there's all these kind of.
No.
So how do you sort of keep sanity and say, okay, we're going to chase these downstream effects so far, but only so far?
I think theory gives you that guidance, right? Understanding of the context and economic theory tells you about that. So, for example, some of those things like what we called, what I was calling disutility, like unobserved disutility, like the welfare effects, right? So I gave the example of family separation, right? Now, it turns out what we learned in that project is that there is unobserved disutility that we should be measuring, but it's not coming from family separation. It turns out what we learned from the migrants is that being away for a few weeks, because it's seasonal return migration, being away for a few weeks is not such a big deal. But what really matters to them is the bad housing conditions. You go and live in an urban slum, you're sharing space with like 6 other men, and it's just really unpleasant, right? So then, you know, you can learn about like what matters to people, right? And then from other research, we know that risk sharing is really important because when people are extremely poor, insurance becomes really important. And if the risk sharing networks fray, that's going to have a profound effect on people's lives, right? So we use theory to guide us as to like what are the important boxes to check and not go crazy with things that are less.
And I would also map that on to kind of what you're hearing from implementers or government or who might want to take up such a program, right? So I once tried to pitch the No Lean Season program to the Ministry of Social Protection in Peru. And the reaction there was immediately, oh, like you're making people migrate. Oh, they're gonna have problems in their families. They're gonna the kids are gonna suffer. And I was able to point to researchers, you know, like, well, they've thought of some of these questions as well. So I think if you map those things on, it's.
So here's something else that we didn't get to, like that was the next plan, like when we shut down the program, which is that look, when you get people to migrate, like what we learn is actually, like wages don't fall in the village as much anymore. Right? Because there's not so many people competing for a few jobs, right? And then, so wages go up. So who's paying those wages? It's the employers, who are the landowners, right? Now the landowners, they're the politically powerful as well, right? So now that might be a small economic effect on the landowners, which we don't care too much about. However, politically, if they're well organized, they can shut down the program, right? So that's what I mean by theory guiding what you should pay attention to, because if the program gets shut down because of the political dynamic, then that's like the existential crisis of the program.
Mm-hmm.
Yeah, that's really fascinating. I guess thinking about, again, these sort of downstream effects, and that's kind of one form of adjustment. I was going to ask a question about adjustment. I was thinking about it more on the positive side, but you had kind of mentioned, you know, a scenario where, okay, if all of a sudden you could upskill a bunch of people, you know, maybe but there still aren't jobs, you know, then maybe you kind of create a new competitive dynamics, not so great.
Yeah.
But how do you think about the dynamics, and I know you think about this, but how do you think about the dynamics of the economy and the adjustment? Because if I could wave a magic wand and say, okay, everybody now has all these new skills, I would say, I'll do it, and I'll trust that that will kind of be absorbed, or somebody will kind of figure out how to come along and employ those people, even if they're not there immediately. So, what, how do you think about the time horizon of more than just
exactly?
The short term?
So yeah, and when I say that, look, we need to guide theory and check those boxes. And we need to use modeling. That's exactly the type of thinking that has to go into it. Like, I can't answer that question right now. I would have to spend like a couple of days at least thinking about it with some paper, right? But like, we'll have some research on labor market dynamics, let's say from Brazil, right? That can guide our thinking there, right? So, and then actually I'm gonna make it even more complex, okay? Which is that, let's say we do, you're providing skills to some small entrepreneurs, right? And that way you raise, say, their productivity by 10%, and the effective altruism community is thinking carefully about, is that a cost-effective thing to do? How much welfare does that generate? Should we be funding that? Okay? Now the big question might be, why is it that there's so many, like, let's say this is in India or Africa, why are there so many small entrepreneurs there? Why don't they ever grow, right? And we might also use the same field settings, these opportunities, to answer those much bigger picture questions too, right? Because the fundamental cause of the underdevelopment might be that there's some regulatory burden or policy that's keeping firms too small, right? And then it's no longer like a 5%, 10% increase. We just like change. We want the firm size distribution in India to look like the firm size distribution in the United States. Right? And we should not give up on those questions either at the same time. And to generate rigorous evidence on that big question, these sites are also important.
How do you think about how much trust to put on just kind of individual participants' revealed preferences? Like, you could weigh, that 10% that are continuing to do it. That means something, right? That they are continuing to do it. But then you've got your whole body of theory and other findings. Excellent.
If you'd asked me this question 5 years ago, I would have had to make you a co-author on that paper. So, and here's how we.
By that much.
Yeah, here's how we end up like understanding something about disutility. So I earlier said that disutility, like family separation or bad living conditions, that's not directly measurable. I can't ask people questions. How much do you miss your kids? So how do we infer that? Okay. So I showed you that like an extra 25 people were migrating initially, and then like 10, 12 of them choose to go back again. And I was saying the 10, 12 going back again was a good signal, right? But in my measure of income increasing, right, there was actually 80% of those people, of the 25, that were successful, okay? And only 50% of them chose to go back again. So that change, right, the fact that I'm measuring 80% of people as successful, but only 50% of them are choosing to go back, suggests that I did not measure things correctly, right? And why is there a gap? The gap must be things I did not observe, right? So those types of, now I'm trying to explain a macro model intuitively, but those types of moments in the data jointly will allow me to make inferences about what that disutility must have been.
Okay, couple rapid fire questions. We have just a few minutes left. Questions are flowing in here at the end, so office hours will be a great place to ask some of these that I won't be able to get to every last one, and I'll come to that as well. One really interesting, I'll ask a couple and you guys can sound off on them maybe jointly. Do you have any guidance for other organizations on how much of their resources should go to the ongoing questioning of their work? Do you think that EA should start building implementation-focused or kind of scaling-up-focused organizations? And what have you learned about managing your funders through the process of questioning your own work on an ongoing basis?
Yeah. So I absolutely would love to see EA fund organizations or start organizations or join alongside other organizations that are working on scaling and implementation in particular. I think that's a huge gap, and I would love to talk to anyone who wants to do that. It's a dream of mine as well. But I think on the, how we manage funders through some of these challenges, I think, some of the best lesson for dealing with funders is really just to tell them what's going on early, and ask for advice and not forgiveness, tell them what's going on as it's happening, right? Rather than coming back and saying, oh, this thing happened and we're not really sure. And I think working with people, especially if you're working with them in a crisis, like we had to do, that you already have built trust with. So I think there's a strong kind of trust and partnership building component of working with funders over time that's really important. And being truthful and upfront and clear about what you don't know as well is really important.
Yeah, and we as a community, research community, we also have some responsibility and some blame for why things don't scale, right? Which is that not all of us engage with implementers or funders or EA donors in the way that we should. Like we really need to also have some skin in the game. I think so that's part of also what building Y-Rise is about, is identifying people who are willing to make those commitments.
And I guess I would say one more thing. I think EA is very inclined to start new things. I think one thing I would want to push is to think about what are the organizations like BRAC or others that are already operating at scale, and how can we crowd in partnerships and resources to help improve them.
Yeah.
Cool. Well, that is all the time we have, not all the questions we have. So for additional questions, and I'm sorry if I didn't get to yours, meet us outside in the lobby area for office hours immediately following this. But for now, how about another round of applause for Mushfiq Mobarak and Heidi McAnnally-Linz. Thank you guys very much. Great job, guys.